Hello, it's Dr. Rhonda Johnson. Today is Friday, October 28th, 2022, and I am talking about Ebola outbreak in Uganda. Now, we know that infectious diseases do not respect borders. People are traveling further and further more frequently. There's deforestation, there's climate change. People and animals are in contact where they have not been before. We've learned through this pandemic it is so easy to spread diseases globally, and that something that happens in a remote part of the world can very easily become something that happens where we live. So today I'm discussing Ebola and the viral outbreak to very much keep our eyes on. Now, in recent years, we've seen deadly Ebola outbreaks in Africa. Recall the 2014 to 2016 Ebola outbreak in West Africa that killed more than 11,000 people and left an estimated 30,000 children orphaned. Now, Ebola is a highly feared virus because certain strains of the virus carry a very high mortality rate. Experts say the death rate for the Ebola virus is quite high, anywhere between 50 to 90% mortality rate. Now, there are 5 separate species of the Ebola virus. The Sudan strain of Ebola is currently circulating in Uganda, and it carries around a 50% mortality rate. There is no proven vaccine or treatment for the Sudan strain of Ebola. Now, how is Ebola spread? It's spread through contact with body fluids such as saliva, breast milk, vomit, semen, sweat, and other body fluids. Risk factors for spreading the disease include traveling to areas where Ebola is prominent, particularly if you come in contact with those who are infected. Now, symptoms can include fever, vomiting, diarrhea, muscle pain, and internal and external bleeding. Now, the incubation period can be as long as 21 days. Now, how is Ebola diagnosed? It's diagnosed using a blood test. But symptoms in the early phase can include headache, fever, chills, fatigue, abdominal pain, diarrhea, and vomiting. So again, these are symptoms that could be a part of any infectious disease. But again, what makes a difference is if you're in contact with a known Ebola patient. Now, again, I mentioned there's no treatment. Doctors use supportive care. Now, as far as the U.S. is concerned, the CDC is screening all arriving passengers from Uganda to the United States. They have to have their travel routed through 5 airports for expanded medical screening. Now, I think this Ebola outbreak, as well as outbreaks that preceded it, are very important. It tells us we need to continue to invest in robust public health, not only here at home, but around the world. This is a disease that scientists still have much to learn about. The animal reservoir for this virus is unknown. Now, to the people of Uganda that are battling this horrible disease, I hope and pray that your healthcare infrastructure has the resources it needs to combat this outbreak, and that the people, the ordinary people, have the tools and the knowledge to avoid infection. And please know that there are people who care about you around the world. That's my message today. As always, please be careful, folks, and take care.